It really actually 85 to 90% of the time is actually from not making enough stomach acid, which is kind of counterintuitive to what you would think.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast. Today, we're going to be continuing our gut health series. For this particular series, we brought on specialist Dr. Michelle Retz, who is faculty at the Southwest College of Naturopathic Medicine, where she teaches gastroenterology. And she's also a member here, a physician here at Ethos Integrative Medicine. Dr. Michelle, welcome back to the show.
Thanks for having me.
In our last episode, we went and kind of gave a brief overview of gut health, and we discussed a number of topics that fall into gut health, having to do with digestion, immunity, different things like that. And we really just gave the basic overview. So today we're going to be diving more into digestion and absorption, what that looks like, and what happens when those things go wrong, and talking about some of the approaches that the different approaches you can have for given conditions such as heartburn, different things like that, and why those approaches are different and the pros and cons to each one. Let's dive into digestion, where we're looking at basically how we break down food, essentially, right? So walk us a little bit, give us a kind of a brief overview of what that looks like, and then we'll start diving into where problems can occur.
Sure. I think I mentioned last time, but digestion starts in the mouth, with your saliva. You start breaking it down there. So usually folks don't have an issue in the mouth unless they're on a medication that dries them out, or they have an autoimmune concern like Sjogren's or something that's going to make their mouth dry. So that, could compromise it in the beginning. But usually, you swallow your food, it goes down the esophagus nice and smoothly. The vagus nerve is the main nerve in the digestive system that runs all the way from the esophagus all the way down to the large intestine, almost the entire length. So So food should get smoothly down to the bottom to the stomach. There's a little door there, a little sphincter that opens up, lets the food in. The stomach has all these amazing, beautiful, they're called rugae, these nice little folds, right? And they really do a good job of creating a nice soup of food. So they secrete a bunch of acid and enzymes that get the digestive process started. And that's really the cue for everything else, aside from just the sight and smell of food, because that really does stimulate a lot of things internally just from the jump, when you see it, when you smell it. The stomach then is probably the second largest signal. If something's wrong in the stomach with not making enough acid, not knowing it's receiving food, not doing a good job of either treating an infection or mashing up the food, everything down the line is affected and compromised. So right now we're just assuming everything is good. So we get this really beautiful mixed up soup of food, very fine particles that then in a really good low pH, really acidic, goes into the small intestine. The pancreas is like, oh, we got something coming in. He senses the low pH and he knows to put out bicarbonate to alkalinize the gut, to raise the pH so the rest of digestion can happen. And then he knows to put out his enzymes to help digest it. And the gallbladder gets the cue also, we've got fat coming in. Good. I'm going to put out some bile. And everybody is going to work to further digest that food. They're used to seeing mashed up food in small particles that they can work on really easily. And the wall of the small intestine has all of these little enzymes. They're called little brush border enzymes that are used to chewing up littler pieces of food. So they also assist in the digestive process. So everything should be smooth, well coordinated, right? Peristalsis should move everything from top to bottom, nice and easy. There shouldn't be any bloating or belching or gas. Food shouldn't get stuck. It should just move right through. 90% of our nutrients are absorbed in the small intestine, and that's three different parts, which we don't need to know the details of. But all of your vitamins and nutrients, fat, protein, carbs, is all absorbed in the small intestine.
Okay.
And it gets down to the ileum, which is the very last part of the small intestine, and that's where we recycle our bile and where we take in our B12. So a couple things can happen with folks who have areas of concern with that that part of the gut is inflamed, then everything goes into the large intestine. And the large intestine really is just compacting the bits of food we didn't absorb and absorbing water. So it's really focused on making stool and absorbing water and a little bit of electrolytes. So the kidneys say, yeah, we need a little more magnesium. We need a little more potassium. Could you take that out? That's really all the large intestine is doing, is just making it nice and formed, getting it all the way down till we get it out.
Okay, awesome.
And that's really basic digestion.
Yeah, right on. As you said, if there's an issue that goes on at the area of the stomach, that's when we can start to see this chain of effect down the road and these issues with digestion and absorption and stuff like that. So what are some of those things that can occur in the stomach that can cause this to occur?
The biggest thing that I see is low stomach acid production. Mm-hmm. And that's a term called hypochlorhydria, which you don't need to get fancy, but it really just means you're not making as much stomach acid either as you used to, or you may come into the world just making a little bit less than the average bear.
Okay.
It's normal for us to make less stomach acid as we age. Our appetite declines. We don't eat as robustly as we did when we were 20, when we're 70, and we don't make as much stomach acid. So that is a normal process. But some folks do come into the world just not making a lot of stomach acid.
Okay.
So what that looks like is when you start eating and food finally reaches the stomach, it just feels like it sits there like a stone. It does not move. Most pronounced would be the harder things to digest that require more stomach acid, like red meat, broccoli, cauliflower, Brussels sprouts, these really hearty vegetables that even when cooked are still quite,
fibrous and everything.
Fibrous to break down. And so folks feel like the food doesn't move. It takes a long time. So they get full quickly. They may feel bloated and they haven't eaten that much. So they're not satisfied and they're still somewhat hungry. They're looking at their plate going, but I just like a third of a steak or like a couple pieces of broccoli, or 3 heads of Brussels sprouts and I'm done. Like really, I'm not even full, but I'm uncomfortable and I can't eat more. And not making enough stomach acid. So then we're not digesting that food. It causes bloating, which can cause gas. So there can be some belching. We're still high up in the small intestine and the stomach. So we're not going to have as much gas down below. It's really going to come out through the mouth. So there'll be more belching that way.
Okay.
Or just distension. They visibly look full. They can see food isn't moving or they can see some gas. When you don't make enough stomach acid, one, you don't close the door between the esophagus and the stomach. And so stomach acid it's acidic, it's harmful, it's only really supposed to be contained to the stomach. That's the only area that's designed to have it. We normally hey, we're making food down here, close the door, so that's a robust amount of stomach acid will shut the door to the esophagus so that nothing that you make splashes up and damages any other area. But if you don't make enough or just a small or medium amount, that door will stay open. And what you do make is able to come up into the esophagus and can cause heartburn or redness or erosion of the tissue and set you up for pain, ulcers, even food sensitivities or asthma. Because that nerve that serves the esophagus, once the tissue gets eroded, it can tickle those fibers. It can burn those nerve fibers and cause a reflex cough in the lungs. That the vagus nerve serves the lungs as well.
Okay.
So you can see asthma starting from some kind of heartburn or GERD kind of process, which is a really different picture we can chat about.
Yeah.
So there's foods that keep the door to the stomach open, but not making enough stomach acid will also do that. Now, stomach acid, what purpose does it serve? It's supposed to digest our food, but it's also supposed to kill what comes in on our food. Bacteria, yeast, viruses, parasites. We do the best we can to cook our food well. We miss it here and there, right?
Yeah.
But that's okay because we have a strong immune system and we're supposed to have stomach acid. So if we don't have enough, there's a good chance we're possibly missing these things. And they're getting to come in to the small intestine and potentially seed, find a place to live and start a population to grow. So it sets us up for infection of many different kinds. And we talked about the conversation between the stomach and the rest of the digestive tract. If we don't make enough acid, we don't mash up our food very well, and we don't get that pH down low enough, the pancreas misses the signal. He's like, food starts coming into the small intestine, and he goes, are we digesting right now? Are you kidding me? I didn't even get the memo. I didn't even know we were eating food. Holy crap. Hold on just a minute. Let me get some enzymes. But he doesn't really make enough bicarb to sufficiently alkalinize the gut. And not enough enzymes are made. It's not as great of a response as we typically get. So we're having improper digestion of food bits that are already bigger than they should be. So he's like, I don't really know that I'm up for this task, but okay. I gotta mount up somehow, right? Gallbladder, same way. I was like, oh, we're eating? Okay, hold on. Let me get some bile. Throws out some bile, but it's not as much as you typically would see when you make enough stomach acid and everybody gets the message, right?
Okay.
So you have large chunks of food coming into the small intestine. The gallbladder and pancreas are like, oh my gosh. And the little enzymes on the wall of the small intestine are like, oh, okay, there's no way we can handle these big chunks of food. We'll do what we can, but George, we just can't get all of this. So they do what they can. But the bigger pieces of food that don't get broken down are then able to feed bacteria in that area all the way through the small intestine because they're not going to get absorbed because they need to be in really small particles for us to absorb. It's really picky about what size and when it wants things to come in. And so if it's not in the right size or the way we normally see it, we're not going to let it in for our protection.
Yeah.
So the bacteria, yeast, parasites, viruses, whatever we didn't kill on our food now can set up shop and also be fed. And so that sets us up potentially for infection or overgrowth of our own good flora, which we'll talk about in another series, can look like many different symptoms. Now we got a whole host of other issues because we just simply didn't make enough stomach acid. You see how the the process really relies on the stomach acid, the pH, and the food being well digested. It kicks up a lot of air, gas, belching, bloating, just distension and fullness, discomfort when we're not digesting our food and we have all of those extra bugs being fed. They often make gas as a byproduct of just they ferment food. That's how they eat. So that's where all that gas comes from. And then the immune system is, hanging out in there. And their job is to look at everything as friend or foe. And they see these huge pieces of food coming and they're like, all right, guys, get on board. We got some foreigners coming here that we don't recognize. There's really big pieces of whatever it might be. So they're on guard a little bit because everything is supposed to be really well recognized. Small bits of protein, small bits of carbs, right? And they're like, wow, mountains of food. Okay, on guard. So they're already kicked up a little bit and there's a propensity to have them react to proteins usually, but it could be any part of the food because it's big and they don't recognize it and they're supposed to protect us. So it sets us up for food sensitivity, food allergy, or a subtle reaction like that.
Okay. I mean, like you said, obviously everything starts with stomach, and if we have an issue there, it trickles down. Now, you mentioned as we age, we have a decreased amount of stomach acid production. Is there an age that we start to notice that decline?
I've looked at the curves, but not really. It seems like 50 to 60, I would say, is when it becomes more noticeable. I couldn't make that sweeping statement. I've seen teenagers, 20-year-olds with significant decreased acid production and 80-year-olds with a lot. So I'm not going to put a blanket statement on anyone, but definitely 50s and 60s, it does start to decline. I would say definitely. And I teach my students, your patients over 65, you really want to be careful about how you are reimbursing their acid, so to speak. So if you're going to help their body make more stomach acid or you want to provide them digestive support, you just need to be careful about what form you do because 65 and older, they tend to be a little more sensitive to those products that have direct stomach acid or betaine HCl in it. So
that makes sense.
So yeah, I'd say 60s, I'd start to see a significant decline.
Okay. One of the main things that you mentioned, and I think one of the common misconceptions on when we're looking at digestive health and specifically the stomach is when we're looking at heartburn. Can you explain a little bit about what heartburn is? And then we'll kind of go into what the traditional way of treating heartburn is and why that may be missing the boat.
Sure. Heartburn is the sensation of burning or warmth or discomfort. Usually there's a burning sensation. From the stomach, which is kind of at the bottom of the sternum or up behind the sternum that can go all the way up really to the throat where your larynx is. Sometimes people just have phlegm in the throat. They feel a lump in the throat, right at the base of their throat, their larynx, where they always want to clear their throat. But it's not just in the morning and it's not just after a meal. It's like all day long, they're clearing their throat and I feel like I feel like there's this ball of phlegm I just can't get rid of. Or the burning and the discomfort are the most common, I would say. But some folks do just have a hoarseness. They can lose their voice because the acid is actually getting up into the larynx and they may not have that burning pain, but it's actually damaging the vocal cords or the phlegm, the ball in the throat, that kind of chronic symptom. It has to do with that door between the stomach and the esophagus staying open rather than being closed. So it seems counterintuitive. We think if you're having heartburn, it seems like you're making too much stomach acid. Like, shut that down, right? You're just making too much. And why are you making too much? We can talk about that. But it really actually 85 to 90% of the time is actually from not making enough stomach acid. So it's kind of counterintuitive to what you would think, or to having some foods that keep the door between the stomach and the esophagus open. So they relax that sphincter and they allow whatever stomach acid you make to just splash on up any time of day. So those foods typically, so I'll run through the list, and I don't tell people that they need to avoid all of these foods, but if you're having some of these symptoms, it's worth paying attention to what's coming into your diet and looking at those individually and seeing which ones might be aggravating you more than the next person. Dairy is a common association. Spicy, greasy, fatty foods, for sure. Everyone, knows that spicy foods can do it, but greasy foods, fatty foods can do it as well. Citrus, lemon, lime, and orange are very common. People like lemon in their water. It really helps the gallbladder, but it can actually aggravate, heartburn. Coffee, caffeine. So it doesn't have to be coffee. It could be tea, energy drinks, yerba mate, kombucha, anything caffeinated, or even our healthier drinks.
Yeah.
Dagnabbit.
Yeah.
Right? Green tea even. Tomatoes, garlic, black pepper, onions, mints like spearmint and peppermint. If you're having those mints in your mouth, or gums, sometimes that will do it. Chocolate, dare I say. Too much chocolate can actually relax that sphincter. Alcohol and smoking. That's probably the full list. And again, it's not a cut all of these things out of your life, but if you are having these symptoms and you're getting those foods in, it's worth looking at each one of them individually, perhaps and taking them out and seeing how much they're contributing to what you're feeling. So those will keep the door open. So it doesn't matter how much stomach acid you do or don't make. If you're just getting those and you're already having symptoms, I would just start looking at your diet and potentially what's keeping the door open, because simply removing that will help close the door. And if you've been good and you're not having a lot of those foods and you're still having the symptoms, there could be something else that's keeping the door open, which is not making enough stomach acid. So as I said, typically the stomach wants to alert everybody that we're getting ready to digest. Close the top, close the bottom. We've got some serious acidity that's going to happen. We don't want it to get anywhere. Well, the acid is the note that does that. And if you don't make enough, the sphincter, that door, doesn't close. It just stays open. It doesn't know that you're digesting. It doesn't know, there wasn't a huge signal of like low pH. And so the door stays open. So the little or medium amount that you make just comes right up and splashes. So it can cause those symptoms. So it sounds counterintuitive. You wouldn't make enough stomach acid, and yet you're having heartburn. And that's why. So when I explain this to patients, there's a few easy ways you can figure out which side of the camp that you're on. When you're having heartburn, in the moment, there are a few things that you can take that will actually increase your body's ability to make its own stomach acid and pancreatic enzymes. If the problem is low stomach acid and we give you something that helps you make more stomach acid, it should shut the door and your heartburn should go away.
Right.
So in the moment when you're having the heartburn, if you take apple cider vinegar or bitters, there's herbal blends, liquid blends you can get at Sprouts or your natural food store that are called bitters that also help the stomach make more acid. In the moment, you take a teaspoon of apple cider vinegar in some water, or you just choke it back real quick, or 2 droppers of the bitters in some water and take that back. Within 2 to 5 minutes, your heartburn should really significantly get better or go away if you don't make enough stomach acid. So that's an easy thing that you can do in the moment to understand which side of the fence you're on.
Yeah.
If you take the apple cider vinegar and it actually aggravates you, you do have a problem of too much stomach acid production, and then we kind of need to treat it in a little bit different of a way. It actually is too much stomach acid. It's not the door that's open. You're producing too much, and we need to figure out what's going on there. Okay. But I would say 85 to 90% of my patients aren't making enough. Now, why? We come into the world, so 10% of us might just come into the world. That's our weak spot. I tend to see folks have like a weaker spot. When I get sick, it always goes to my lungs. I always get urinary tract infections. It's not the flu. It's not this. It's this. It's one thing. So for some folks, their stomach is their weak spot. Okay, they may not make enough stomach acid. But if the rest of us come into the world, how did we end up making less stomach acid over time if there wasn't some obvious blunder that we would know about, right? Yeah. I think that in our culture, I could only say in America, it's that we're not having enough raw foods, fresh or softly cooked foods that make the body make more stomach acid and pancreatic enzymes. So we've, processed our foods, we're nuking our foods, we're overcooking them. If it's not in the microwave, in the pan or the skillet, we're just cooking them way too much. they're not alive enough, and our stomach doesn't have to make enough stomach acid. He's like, all right, George, I got half an hour. What are you doing? Like I can just sit back. This is already digested. I don't have to do anything. And he's like, yeah, we can take a break. Cool. Let's talk about what we're doing this weekend, So we're not challenging our bodies to just step up to the plate and digest. So I encourage folks to, as we have to heal the tissue and make sure we're clear on the cause. That's always what we're getting under. We want people to feel better, but we need to get under the cause, right? But then part of that, once they're healed, is retraining their body to just make more stomach acid by giving them fresh veggies, salads, carrots and hummus, broccoli and hummus, cauliflower and hummus, cucumbers, tomatoes, fresh fruit rather than cooked fruit, or like Dole peaches in a plastic cup that have been like, sitting there for who knows how long.
Right.
A fresh peach with enzymes that's, alive, living food is what's going to heal your body. And the antioxidants that are released when you eat fresh vegetables, right? That's what's going to help heal the tissue as well and retrain the stomach to make more stomach acid.
Okay. Now the traditional thought in conventional medicine is when we're looking at heartburn, the answer is always too much acid being produced. And so we give an antacid that decreases that amount. Ultimately, based on the theory that we're working on here, or not theory, but fact based on experience, if 85% of people are not producing enough stomach acid, realistically, we're just making the problem worse. PPIs, or the proton pump inhibitors, that are these antacids that decrease. I think, and a lot of times these are some of the worst medications you can be on, because it just jacks everything, like you mentioned. Can you kind of talk about what you've seen in your experience about what these particular medications do, and what you've noticed with people who have been on them long term?
Absolutely. And it's interesting, and thanks for bringing it up, because we're actually seeing a shift in the way gastros and traditional primary cares are recommending these medicines now, given what's come to light in the literature. So yes, originally the thought, and it's very much still an allopathic thought, that the heartburn is too much acid production. So the drugs were designed to shut off acid production. They work wonderfully. The patients feel so much better when they're on the medications because they work 100%. Really well. And sometimes you need that to get something under control just for a second. However, we've just talked about all the reasons why we need stomach acid. So you're right. You are majorly compounding the problem. And then other, new literature is showing that aside from, so now instead of not making enough, you're making zero. You're not making any acid. So you don't have a chance to kill anything that comes in on your food. You're not digesting your food and setting yourself up for bloating, belching, gas, food sensitivities, infections, and dysbiosis or changes in your own flora. These drugs specifically, all the acid blockers, have been associated with a B vitamin deficiency, particularly B12, because one of the proteins in the stomach is made to carry B12 down to the small intestine. And when we shut off acid production, that doesn't happen. Associated with low magnesium, low iron, and now cancer, stomach cancer. Several studies have come out associating these drugs with long-term use with stomach cancer. There were no guidelines, and there aren't typically in traditional medicine for ever really coming off a medication other than a steroid, usually. So the intention was never to take folks off until they started seeing time and time again all these issues, these nutrient deficiencies, because you're not breaking down your food, you're not absorbing, right? And then, oh my God, cancer. So now I'm seeing gastros and PCPs who put patients on saying no more than 3 months. At the 3-month mark, we're back to where we are when they come to see me. We have to figure out what to do. What is it that got you here? Why are you having the heartburn? Right? Is it stress? Is it diet? Is it, you're eating you're reclining 2 hours after you eat, that kind of thing. So it's a Band-Aid and a really good one.
Yeah.
But it doesn't solve anything. And then, folks come to me, that's where we're looking at all of these underlying things. And I'm looking for signs of nutrient deficiencies, numbness and tingling in the hands and the feet for a B12 deficiency, restless legs, cramping, muscle twitches, anxiety, constipation, high blood pressure for a magnesium deficiency, fatigue with a B12 deficiency, and then cancer has its own issue. I won't go there, but has its own signs and symptoms that I'm looking for to try and understand where they are on the spectrum. So really don't want to be on these medications if we can help it.
Yeah.
And most folks come to me and they know that. They just needed to feel better. Their pain was so severe. And I understand. I mean, you've just got to do something to feel, so you've got to function. We have to work. We have to carry on with our lives.
They get sleep. They need to do those things.
Exactly.
Yeah.
So, I get it. But we really are very concerned for many reasons. And then we have to look at how long have you been on it? If you've been on an acid blocker for 2 months or longer, you're automatically going to have changes in your flora, in your good bacteria, your army. So if you've been on it for 2 months or longer, you do need a probiotic as part of your healing regime. If you haven't been on it that long, you may not. But when you're not digesting your food and you're feeding everyone else down there and you're not killing what comes in, we don't even know what's in there and we're feeding it.
Yeah.
Right? So we've got to do something to alleviate that imbalance, as well as heal and understand why we're having, the acid in the first place.
Yeah, no, absolutely. And I think it's important, like you said, when we have individuals who are, having trouble sleeping and it's really impacting their life and they're having trouble because there's heartburn, they're looking for something just like, how can I sleep tonight? That's it. And these medications work extremely well for that. But, what they don't always realize is in the long term, they're doing a lot more damage down the road.
The one thing I will note real quick before we change gears is that nightcap eating, that eating right before bed.
Yeah.
That little snack so you don't need to wake up in the middle of the night or your stomach's not growling in the morning is the worst thing out of anything you could eat. Out of all those foods I said contribute to heartburn, that is the worst thing you can do when you have heartburn, because then you're going to lie down and the door's open and you're going to lie down and you're just basically inviting acid to come up.
Right.
And the levels spike so much higher. I mean, there's studies done to measure how much stomach acid you make after a cup of coffee or after breakfast or dinner, far higher at that little nightcap you're eating at 10:30 at night before you go to bed at 11. Way worse. So make sure you eat a really good solid dinner with a lot of protein and fat to keep yourself full so you don't need that nightcap.
Yeah.
And that definitely will help you feel better through the night.
Awesome. Perfect. I appreciate you sharing that advice for our listeners. But one of the other things that we can have issues with when it comes to the stomach problems is ulcers. Mm-hmm. Can you kind of talk a little bit about what the ulcers are, how they develop, and what problems they cause down the road?
There's probably two main causes of ulcers. The first being stress. And stress can cause everything. But cortisol, when you're in a state of stress, whatever that is, and stress really is just the perception that you don't have the resources to deal with whatever you're experiencing in that moment. So whatever that might mean to you, you're in that fight or flight mode, I've got to deal with this, your cortisol levels rise. That's what raises your blood sugar so you can run from the bear, because that's how the body, we're going to die, run from the bear. Yeah. It doesn't matter what it is. But that cortisol level just depletes the mucus lining from top to bottom. And that's what protects us from our own stomach acid in the esophagus, the stomach, the small intestine, all the way down. So the more stressed we are, the more we're just chewing away at that protective layer, the more susceptible we are to the normal amount of acid we make, or now the more that we have that door open, maybe we have some more splashing up than we should, or just the surface in the stomach itself. Now we're just really more vulnerable to what we are making. And so that acid is no joke. I mean, it's pH of 0.8, 1.1. I mean, really acidic. So, as long as it gets exposure to the mucosa, it just starts breaking it down. So that's how you stress yourself into an ulcer. That's how you stress yourself into heartburn. That's what's happening.
Okay.
So when that's a picture for folks, treat the cause. You've got to get behind whatever that is. If it's a physical stress, pain, mental, emotional, boss, relationships, you need to get divorced, whatever it is, behind, right?
Yeah.
And treat the cause. We got to get behind that.
Yeah, for sure.
While we help you feel better. The second and really common is a bacterial infection by a bug called H. pylori, Helicobacter pylori. New information has come to light on actually how well that guy gets in, but it's usually found on food that's not well cooked, fecal oral contamination. So, salads that had stool on them from the cow that washed downhill and it wasn't washed off well enough. Now we're actually seeing that guy can hide in yeast and not be found. So if there's yeast on your food and you have a little bit of a yeast issue, or you're not making enough stomach acid, he's hiding inside the yeast. It's brilliant, right? I mean, just brilliant. They make buds. They're so smart. Anyway, so aggravating to treat. But really common in areas of poor sanitary conditions, overcrowding, where one person in the home has the infection already and may not know it. It can easily be spread. It can grow on food and live on food for up to 3 days, just sitting out. So if food is sitting out on the counter, or there are areas of non-refrigeration, or we're talking about like lower socioeconomic conditions, right? Healthcare workers have an increased risk, but really it's those poor sanitary conditions, overcrowding, probably lower socioeconomic areas where you do see a prevalence of 10% or more. And so that bug comes in, he makes an enzyme that alkalinizes his environment around him, that protects him against the stomach acid that we make. So he just snuggles right up into the lining, and we make stomach acid to try to kill him, but he's like, he's got his force field, right, of urease, and he can live in there. So what happens is our immune system on the other end of the stomach comes and tries to attack him. We know he's there.
Right.
Our white blood cells come in and they take all their, antioxidant, their free radicals, and they're trying to kill him, and we actually create the ulcer trying to kill the bug.
Right.
So it's our own immune system doing its due diligence to kill something, but he's so brilliant that we can't get at him. We actually create our own ulcer. So you have to do a breath test to check for H. pylori. There's a blood test and a stool test. The blood test is the worst test ever. Don't ever do it. It's highly inefficient at detecting it and being reliable. In children 11 years and younger, you can only do the stool test. The breath test is not reliable. So if we're looking at kids where we actually are having heartburn or ulcers, we do need to do the stool test. That's the best test. It's the second best for adults. Otherwise, it's a breath test. You drink a hydrogen drink, you measure out how much hydrogen you produce, correct, and you can tell whether or not the bacteria is there. And then if you have it, we either treat it with antibiotics or natural antibiotics and some other things to heal the mucosa and get rid of it. And usually it's not a problem and it doesn't come back. However, if it's not found, it can set you up for increased cancer rates, stomach cancer rates. So they're seeing that as well. A big concern of mine is, first, folks should know, you can never assume the symptoms, the severity of the symptoms you have with the damage to the mucosa. So if you have 10 out of 10 pain, your stomach and your esophagus could look beautiful and have actually no redness or irritation at all. And if you had mild heartburn, you could have a near perforating ulcer, right? You cannot assume one goes with the other, whether there's a bacteria there or not. It's really common today for doctors to just give an antacid to help someone's heartburn without understanding the cause. They want to know if the acidity is the cause of the symptom. And so they just say, take this for 2 weeks and let me know. If you're better, I'll get you a prescription and we'll see you in 3 months when you need to come off of it. But they're not checking for H. pylori as a cause of that heartburn or that acidity, and they could miss an infection. So it's not okay if your doctor just gave you this medicine and didn't work you up further, or if it's not helping, you need to do the breath test to make sure, you're checking for that bug. So I'm seeing that, and that's concerning. So just be on the lookout for that.
I find that pretty frequently, where oftentimes, and we'll dive into this in another series that we have planned, but oftentimes like doctors will run either a blood test or a stool test, basically because the insurance coverage is what's going to do that, right? And so stuff gets missed because of that. Mm-hmm. Last topic before we wrap up is, let's dive in a little bit into, if we go down the chain. So we talked about saliva production and enzyme production in the mouth. We went into the stomach, which seems to be the peak of digestion at this point, right? Since it affects everything else down the chain. Next thing in the chain would be the small intestine, where we do produce, like you said, sodium bicarb, in addition to some other enzymes to help with digestion. Can you talk about that a little bit? And what are some issues that can occur within the small intestine? Yeah,
so once food gets down there, say the stomach's working beautifully, but maybe it's the pancreas or the gallbladder or the actual small intestine that's compromised in some way, it usually will show up as bloating, belching, gas, or discomfort. And it's very vague. That's about as vague as it gets.
Yeah.
You can't really tell right off the bat what it is, but it usually involves those symptoms. So the food may move through the stomach, but you may feel a little bit bloated down lower around the belly button. That usually indicates more of a pancreatic or small intestine issue. And so we're often looking on the other end of what comes out to help us understand what's going on. So looking at your stool actually is really beneficial. And if you come see me, we're going to talk about poop.
Yeah.
So you better start looking, because it's really helpful for me to understand what's going on. Early on, if you have trouble with fats, or if you start looking at if you feel discomfort or nausea or bloating after you eat fats, whether it's avocados, coconut oil, eggs, pork, fried foods. It could be a gallbladder issue. Bile is what we use as a scaffolding to hold up our fats so that the lipase from the pancreas can chew at it like little piranhas and break it down. And so if it's really bothering you to have those foods, it can be very painful. Either it can cause just cramping pain, really strong pain in the upper right side of the tummy under the rib cage after a meal, or within 2 or 3 hours after a meal that lasts 2 to 3 hours, that might radiate to the right shoulder or go straight to the back. That could be the gallbladder. And that's either struggling to put bile out, like it's thick and sludgy, like mud, and it's really just having a hard time getting it out, or it's just not making enough. Then you'll have issues with fats. So nausea is unique to the gallbladder usually. And so on the other end, if we're looking at our stool and we see undigested food in our stool, it's really not okay. We should only see corn. That's the normal thing to see. If you see any food at all, you don't know what, but you're likely not making enough stomach acid or pancreatic enzymes to help. If the stool floats, if it's tan, yellow, if you're having issues with fats you already know of, or if you see like some fat in the stool, some people can actually see like oily consistency. Right. That's fat that's coming through in your stool. If it should always sink to the bottom, right? And it should be brown, like a regular brown color. So if it's floating, there's extra fat. You're not digesting your fats, and there's likely an issue with gallbladder and or pancreas. We don't know if it's one or the other or both. So both would need some support. It's harder to tell with the small intestine because there's so many enzymes, little enzymes along the wall.
Absolutely.
But I will say, if folks have an issue where there's inflammation on the border, they can have intolerances to food that they may not actually have an intolerance to, simply because those enzymes get destroyed as the wall gets destroyed. So dairy oftentimes can be an issue, but when you heal up the lining, then they're able to process dairy just fine. It was just that they didn't make the lactase enzymes because they sit on the wall. As long as the wall is, inflamed or having an issue, they don't deal with dairy very well, whether it's goat cheese or cow milk or whatever it is. So healing the lining, sometimes you'll see changes in that, and that's what that is. It's not that you were lactose intolerant and now you're not, or you had a dairy sensitivity and now you don't. It's just that you literally didn't have the enzymes and now you do. And so food sensitivities and food allergies is a huge topic that we can get into, but this is what we're starting to, breach on the border of, is other issues with the small intestine, with the flora and your immune system's ability to confuse a protein in your food with something else. So those are probably the bigger issues for other times. And then when we look at things that will compromise the mucosa and the way that you absorb, that'll affect a whole host of issues, how much you're taking in, right? And whether or not your immune system's having a healthy response to what you're taking in. So that'd probably be conversation for our next podcast.
Absolutely.
But that's kind of where we're going. Mm-hmm.
Awesome. Perfect. Well, great. I think we threw a lot of information out at our listeners. So we'll go ahead and wrap this episode up. In our next episode, we're going to be discussing what type of infections can impact your gut and the impact that has on your overall health. Dr. Retz, thank you so much for being on this show.
My pleasure. Thank you for having me.
We'll obviously have her back on the next episode. And everyone, thank you for listening. Hope you have a great day.
Wanting to look youthful and age gracefully? Our team at Ethos Aesthetic Medicine love working with individuals who want natural-looking results with minimal downtime. Our Ethos Glow approach is designed to help you show up as your absolute best self by giving you brighter, more even, and youthful-looking skin. Ask our team how you can get more information on our Ethos Glow approach to achieve natural-looking results that make you shine.